The following is a case presentation utilizing a bioinductive implant for the management of rotator cuff defects created after debridement of calcific deposits. After inspection of the joint space, we turn our attention to the subacromial space, where the calcific deposit is identified and probed. An 18-gauge needle can be utilized to trephinate the calcific deposit. Mechanical shaver is then used to remove the calcium deposit, and further trephination can be carried out to unroof the rotator cuff, allowing the deposit to escape. Once the deposit has been milked out of the rotator cuff tissue, we can then go about carrying out our evaluation of the remaining rotator cuff tissue to determine the amount of defect left behind. Palpation using a blunt object may be used to help identify the integrity of the remaining tissue. Next, a low accessory portal is created and the guide pin is inserted into the humeral head. This is typically 5 millimeters off the lateral edge of the lateral footprint. The mechanical shaver is then introduced to remove any fascia from around the K-wire, and the bioinductive implant is slid over top of the K-wire and placed in the location of the defect. The graft is then unfurled and held in place with its guide. Percutaneous incisions are then used to insert the cannula and allow for the placement of our PLA staples through the graft into the native rotator cuff tissue. Placement is usually begun medially to secure the graft in place. Once the implant has been secured anteriorly, posterior, and medially, we can then turn our attention towards removing the guide which held the graft in place. We then move laterally, where we percutaneously insert 2 PEEK staples into the lateral footprint. Care is taken not to medialize the implant when placing these staples. Once the implant has been secured and the lateral footprint has been anchored down, we take the shoulder through a full range of motion to ensure integrity and stability of the graft